name's Tracy, and this is my assignment for my 500-hour yoga teacher training certificate. And the assignment today is on cardiovascular disease and yoga. So the assignment reads as follows. You have 3 students in your class that have either hypertension or a history of heart disease. All 3 are cleared by their physicians to participate. So your assignment is question 1. One of the students is interested in taking a fast-paced vinyasa class and mentions this to you. What do you say? So for a fast-paced vinyasa, if you have hypertension or any kind of heart disease, the answer to that is going to really be no. Let's think of some other yoga classes that would work better for that. You want to avoid, if you have hypertension or heart disease, anything like a Bikram yoga with all the poses, hot yoga, really fast-paced vinyasa flows. And it's because you don't want to tax the heart. You don't want the heart to start racing, getting up there in beats per minute. You just want to kind of think of your yoga practice as something more of a nice, relaxed class. Like if you were taking a very slow vinyasa flow, that might work, but fast-paced isn't going to work for that. So just some better choices out there. Make a video teaching a modification for tree pose. Tree pose is Vrikasana. I really like this pose. Tree pose has always been one of my favorites. So I think a great modification for tree pose is really just in the way that we start. So just start, take that nice breath up, relax the hands down to the sides, take the left foot, ground down into the earth, adjust your posture, tuck the pelvis, lift the shoulders, roll them back, open the chest, lift the chin up, find your drusti, your gaze point. Then instead of doing things like raising the arms all the way up above the head or really pulling that foot up, start off really slow because we want this to be very meditative and very calming. So use the foot, the right foot, almost as a kickstand. So we're not really shaking around too much. So just get into that pose, find that gaze, find your focus point, bring the hands out to the side, open the heart, open the palms. Again, lift the chin. You're just gonna stand in a low tree. Now, if there's someone who's been practicing yoga for a long time, or they really have their hypertension under control, their doctor has signed off on it, then sure, go deeper into the pose. You know, come up higher onto the leg, maybe come all the way up, cross in front on the thigh. Maybe you want to come all the way up and you want to say, like, you know, they've really got it going on. Let's come into the half lotus, standing half lotus. And then even more, you can say, okay, let's start to raise the arms up. Maybe just keep them right here though. Maybe we don't want to go all the way overhead. So lots of ways to kind of enjoy that tree pose without taxing the heart and without it becoming like an exercise. So great for that. Then another thing that can really help with cardiovascular disease or hypertension is pranayama. So the assignment asks to make a video teaching a pranayama for these same 3 students. And so what works best in pranayama or breath work for hypertension, especially in heart disease, is you want them to be like nice, slow, rhythmic breathing. You don't want to get into something that's and you don't want to get into too deep of a breath. And then you also don't want the breath to be uneven. You don't want really too much uneven breathing. So the way that you inhale and hold and exhale and hold are all going to be nice and equal. So one of the breaths that I like in that is Samavriti, which is equal breath. And so if I were going to have my students come in and learn this type of breathing and to kind of enhance that parasympathetic tone, decrease their blood pressure, just kind of get them, you know, enhance their rehabilitation, get them going on the right road to just relieving some of those symptoms. And have them again sit into maybe a Sukhasana, sitting up nice and tall. And again, just relaxing, maybe a cushion underneath them, maybe they need to lean against the wall. ball. Come into like a nice, almost meditative seat. Just relax, let go of tension in the shoulders, lower the eyelids. Start to relax and unwind. And then when you feel the breath nice and even, and you feel yourself ready to start some breath work technique, I would do that beautiful same breathing. And so I would inhale for 4, I would hold for 4, I would exhale for 4, and then hold for 4. So almost a nice box breath, just keeping it nice and equal, just keeping it very calm. So inhale, hold, exhale, hold, inhale, hold, exhale, hold, inhale, Now the desire for this breathing like this is to go on maybe for 3 to 5 minutes. They say do some breath work and breath technique for 30 minutes, but I think with the box breath that I chose, I would say 3 to 5 minutes would be really good for that. And you can either do both. You can inhale and exhale through the nose. I like to personally inhale through the nose and exhale through the mouth. But again, it's the choice of what's gonna probably work best for your student. So again, just keep in mind, avoid the kind of panting type breathing, or avoid anything that just goes way too deep, that bellows kind of breathing. Yeah, and they should be great on their way to like healing some of that hypertension and lowering their blood pressure and feeling a more relaxed and a healthy heart and healthy lifestyle. So thank you.